Welcome back to the Health Longevity Secrets Show with your host, Dr. Robert Lufkin. His book, titled Lies I Taught in Medical School, is a New York Times bestseller. See the show notes for a link to download a free chapter. And now, please enjoy this week's episode as we investigate if rapamycin is the best longevity drug with Dr. Rick Cohen.
Hey everybody, this week we're going to cover one of the most requested and most popular topics, and that is rapamycin, one of my favorite drugs. We get to dive into the fascinating world of longevity research as we explore rapamycin, which is potentially the most powerful anti-aging pharmaceutical currently known. Dr. Rick Cohen, a longevity physician with over 25 years of experience, reveals how this natural molecule discovered on Easter Island targets a fundamental cellular pathway called mTOR, or mechanistic target of rapamycin, that acts as our body's metabolic switch between growth and repair. Now, this episode is sponsored by Gatlin, who makes rapamycin available to their patients in their programs. Now, I'm an advisor to Josh and the folks at Gatlin, but I only advise those companies that I believe in and would use for myself and for my family. Now, this conversation uncovers the remarkable story behind rapamycin's discovery, how it sat literally forgotten in a researcher's freezer for years before its life-extending properties were recognized. Dr. Rick explains that mTOR has been conserved through billions of years of evolution precisely because it's so critical to survival, sensing nutrient availability and telling cells whether to grow or repair themselves. The breadth of rapamycin's benefits is truly remarkable, from hair regrowth and skin rejuvenation, literally to improvements in hearing, fertility, and protection against diseases ranging from Alzheimer's to atherosclerosis. This suggests rapamycin isn't just treating symptoms, but addressing rather a fundamental mechanism of aging itself. So, are you ready to understand how this single pathway could influence every aspect of how we age? Listen now to discover how balancing growth and repair cycles might be the key to extending our lives. This episode is brought to you by L-Nutra, maker of the Prolong fasting mimicking diet. If you'd like to try it, use the link in the show notes for 20% off. What if your routine CT calcium scan could tell you even more? Now, from a single scan, you get 4 powerful reports, not just your coronary artery calcium score, but also your arterial age, liver fat levels, and bone mineral density, with no added radiation or time. It's early detection made smarter, spotting heart disease, metabolic dysfunction, and bone loss before symptoms begin. And now it's available anywhere in the US, no prescription needed. Use the code Lufkin20 for 20% off.
And now, please enjoy this week's episode.
Hey, Rick, thanks for joining us today.
Super. I'm excited to be here and share some hopefully new information or new insights into this topic. Yeah.
I'm so excited to talk about one of my favorite topics, and you're an expert in the area, so I can't wait to learn things from you. And maybe let's start just a basic question. What is mTOR, and why is it so important and going to be so fundamental to our conversations?
Got it. Right. So for anyone new to this space or field, right, mTOR is the mechanism target of rapamycin. And I don't know if you want to get into this story because I'm sure they've heard it before.
Yeah, you could. Yeah, tell them if they. I don't think we've talked about it on this program yet. So
yeah, so it turned out, and there's actually a great podcast on about the story of the discovery of rapamycin, but it was discovered on Easter Island. And there were some scientists that were going to Easter Island before an airport was installed. So it was like this primitive 2,000 miles out in the Pacific Ocean, one of the most isolated locations in the world. The story, as far as I know, is that they were also curious what was in the soil because people walked in the soil and never got tetanus, even though there were lots of horses. So there's something in the soil that they thought was interesting, and they wanted to go get samples. And within the samples, it was discovered there was this antifungal that the bacteria existed. It was a mycin, which was eventually targeted rapamycin, and for Rapa Nui, which is the name of Easter Island. So rapamycin was uncovered, and it had this unique antifungal property, which, will shorten the story, had a also immune modulating property. But that wasn't discovered. And the interesting part of the story was this sample was part of, I don't remember the companies, but it was one scientist who was working the project. The project got sort of canned when a company was sold. So they took it home and they kept it in their ice cream freezer for 10 years or 15 years. The company was repurchased and he was hired, and they said, "Hey, what other projects do you have?" He goes, "Oh, wait, I have this in my freezer." So he took it out, and at that point, they discovered lots of activity. Not only that this molecule had this immune modulating property, but as the name mTOR was, they actually found a mechanism for cellular energy sensing that they named after the molecule they found on rapamycin. So it was like a reverse naming project. So it's crazy how little. I mean, this is only the 90s, right? Like, you go back and, med school in the 80s, no one knew any of this stuff. Like, what we
Yeah.
were taught, just, even to your book. So they have this molecule which was used for um, transplants. So they knew if they used it in a higher amount of dosing, it had an effect on something called mTOR2, which is another variant of this phosphokinase enzyme called mTOR. Um, it was used to sort of prevent the body from, attacking immunologically this transplanted organs. In the, I guess, early 2000s, there was a trial called the intervention ITP, right, which uses three different um, locations, and they test mice, and they look at different molecules. Well, it turns out that rapamycin to this day has the strongest positive effect on lifespan in mice. We can leave it at that because we can go on, and lots of people can talk about that deeply, but that gives the broader picture. But the interesting thing to this, other than the story, which has so many twists to it, and the podcast is Radiolab. That's when it. So Radiolab has a really fun story about it. Is that this mechanism target of rapamycin is something that's been maintained throughout, hundreds of thousands of years, from worms to humans. So evolution has not changed this particular mechanism, these particular enzymes. Well, there are a few out there like that certain proteins, certain hormones that haven't changed very much. But when evolution doesn't change something, you got to perk your ears up and go, it's probably quite important. Um, so mTOR senses energy, it senses nutrients, in simple terms, and at that point, it tells the cell to grow. It tells this cell to multiply or to get bigger or to do all the different variety of tasks. Obviously, it's not a complete on and off. There's a modulation there, but it's get bigger. It's get stronger. The problem with mTOR is it can be triggered by too many calories, right? So if you look at, and the simple solution, the simple way to think about this, and going right up your alley, Robert, is too many calories in today's world, eating all the time. Go back and look at the 1980 New York Yankees. Look at the just I give you the numbers. Like, the average baseball player was 6 feet 185, and now they're 6'2", 220. But just look at them. It's like they look like high school kids. It's quite impressive to see the size of people. Well, why did that happen? mTOR, right? So we're driving mTOR. But the problem is, if you continually to drive mTOR without taking your foot off the pedal, the cells eventually hit a stage where they can't grow anymore, and they modulate into these other stages of cellular function and eventually become harmful cells to the body. And there's a theory by Mikhail Blagosklony, who is the researcher, is a cancer researcher who started in the early 2000s, has a whole series of papers. So if anyone's really interested in reading a non-science, I mean, he's sciencey, but he's also very much philosophical, and I enjoy his reading. So he has a theory called hyperfunction, and basically a lot of our diseases that we experience are due to this mTOR constantly being on. As it turns out, there's another um, side to mTOR. It's called another phosphokinase, adenosine monophosphokinases, AMPK, which balances mTOR, and that's triggered when we're without calories. And when you trigger AMPK and you shut down mTOR, the body begins to sort of clean itself out, right? You can't just party all the time, right? You need to clean the house and reset, and that's what the cell needs to do as well. So um, understanding mTOR and AMPK as this foundational sensing, signaling, cellular health um, mechanism is critical to why we're in this epidemic of metabolic health, right? And once you understand that, and you can understand perhaps how the body needs to cycle on and off, it sort of begins to understand, oh, intermittent fasting, okay, that's where that fits in. Or, you know, going hard and resting and recovering. The body likes to be challenged. It likes on-off states. It doesn't like doing the same thing all the time. So I don't know if that
Hey,
that
yeah.
covers
No, no, okay, let me
without
see if I
getting.
get, let me see if I understand that. So there's this metabolic switch called mTOR that's conserved over billions of years, all the way from yeast to human beings. And the fact that it's conserved means it's really, really important. It's almost like a survival switch that goes on to grow or off to repair or autophagy. And 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 then there's a molecule called rapamycin, a drug that will turn mTOR from the growth state to the repair state. So it turns mTOR down.
Short term. Yeah, and yeah, you said it is a drug, but it's a natural molecule,
It's a
right?
natural
So
molecule.
it's a
Yeah,
natural molecule that's been made into a pharmaceutical agent, whatever.
right.
It's a nuance, but yeah,
It's a
it
natural
hasn't been
molecule.
it hasn't been synthesized.
Good. Yeah, good point. And then AMP kinase is another kinase that actually is linked to mTOR and their beneficial effects of AMP kinase being turned on versus beneficial effects of mTOR being turned off. Does rapamycin affect AMP kinase directly, or is it through mTOR?
mTOR. Yeah, it's primarily rapamycin is primarily targeted to mTOR, and just to sort of a slight switch, there's two main mTOR, isoenzymes, mTOR1 and mTOR2. mTOR1 is the one that has the primarily beneficial effects of tamping down. mTOR2 is the one that you wanted to tamp down if you wanted that immune modulation or immune suppressing effect. The problem, but the challenge with rapamycin is dosing so that you're primarily suppressing mTOR1, but not over suppressing mTOR2, because then you get into the issue of immune suppressing. The difference in how rapamycin is used for metabolic health, and that's how I like to point out rapamycin. It's got this longevity drug. It's a metabolic health. If you think about rapamycin is in the same basket, and by improving metabolic health, guess what? You improve health span, and maybe you add some years. It's hard to say, right? We don't have that data yet. In mice, it does, but mice die of cancer. So cancer for the most part is a metabolic disease. So by reducing or improving metabolic health, now we're allowing these mice to live longer. Um, Nuances that we need to further understand, but think of rapamycin as a metabolic health. And to people, I say it's a metabolic health mm, tool to have in your basket, right? And not everyone may need it. And that's so, and it's another important point that I see is like, ooh, rapamycin is this longevity drug, right? It's out there. I'm going to take it. Yes. Yeah. But understand how you're using it and what you're using it. So, if you see very enthusiastic people using rapamycin, oh well, they're fasting and they're strength training and they're low protein and they're doing all these things which are already suppressing mTOR, and then they're taking polyphenols, berberine, green tea, there's mango extra, there's just a whole cacophony of polyphenols that trigger AMPK. So what are they doing? They're suppressing the body, and the extreme example of that would be if you go back and look at the old biosphere labs, and someone can search, Roy Wolford, UCLA guy, right? I don't,
Yeah.
did you ever, right?
I met him once while he was still alive. Yeah.
Yeah, so when he came out of that biosphere after 2 years of super low calories, he did not look very good. He did not look healthy. Extreme calorie restriction. Um, Immune system was not strong too, so he over suppressed mTOR. We want to not suppress mTOR all the time. We need to have a better regulation of mTOR. So if people have eaten too many calories, and as they get older and the cells are reaching this gerosenescent to senescent state, we need to sort of slow that process or tamp that process down. So using rapamycin in a pulsed way, and even a more sophisticated way, using it in a cycled way, where depending on age, depending on goals, depending on needs, someone may take rapamycin for 2 or 3 months, right? And focus on just maintaining. And then for 1 month, like, I'm going to get anabolic, right? Come off of rapamycin and then really focus on strength training, eating more calories. That's okay, right? For
Mhm.
that month, you're not going to cause some sensitivity, and it resets the body. And now you cycle back through. So that's sort of one of the things that we're working on. The challenge is in the space. So we know rapamycin, work or advise company with 3,000 people using rapamycin, and working with groups and forums that people take rapamycin. It's very clear, and even my personal experience, that rapamycin is a very powerful or beneficial, for metabolic health, right? And I'm hoping that some of the studies are able to show that signal. The problem is everyone is different, and everyone's dosing and everyone's lifestyle is different. So the trick is, how do we determine who needs rapamycin, what's the best dose for them, and then how to monitor the effects, right? Because the first thought is, well, you don't want to have anything harmful, so you don't want to take too much that you're not suppressing mTOR2. So I personally prefer going every 2 weeks. I'd rather pulse it, have a higher dose, and then give the body more time to recover. Seems to work well, and I'm giving little mini cycles as well, as right. So you're cycling through and you're not shutting down all the time. Could be proven wrong, but just intuitively, from what I see, that makes more sense. So you're alleviating some of that mTOR2 effect. The other sort of cool thing to do is, if you look at some of the fasting research through Victor Longo and looking at the AMPK research, those seem to affect mTOR2 as well. They upregulate mTOR2. So there may be a way, and we're working on that too, is to synergize rapamycin and then bring in a short little fast, or perhaps bring in some polyphenols like dihydroberberine, and you could then, or metformin, just for a few days, later in the cycle, to perhaps kick mTOR2 back into gear. And we're looking at people who, one of the not really side effects, but one of the things that some people see, perhaps if mTOR2 is overly stimulated, is their lipids or their glucose may go up a little bit. So for those people, especially those who come in already with a problem, we're actually beginning to add that up front and to see if we get less of that metabolic unwanted effect per se. Um, then, I mean, the other thing is how to determine how much you need, right? How do we know how much rapamycin? It's not like this person, right? We have an influencer driven world. So sometimes people want to take something because there's an educator. And I will never tell you that you need 6 milligrams. And I will tell you if I take 6 milligrams, do not take what I take because I'm taking it for me. And if, actually, for my example, my wife takes it, she takes 8 to 10 milligrams every 2 weeks, well, twice a month. I take 3 milligrams or 2 milligrams, it's not good, right? I, I can't quite figure that out quite yet. So
I mean, isn't the 6 milligrams based on basically Misha Blagosconi, based on Joan Manick's paper where they did 6 milligrams or 8 milligrams or something, and then other influencers talk about it, and for no good reason. I mean, for a
no
while,
good reason.
Misha was taking 10 or 20, because at one point I know, and so how do you know? To get to that question. How do we know when it's too much or too little as far as rapamycin goes? Like how do you modulate the dose? How do you know when it's good? And is it
Yeah. So
so?
so let's start with yeah.
Yeah.
So I guess the first is like if you're seeing metabolic dysfunction, right? The whole idea is to become metabolically healthy, right? So for me, if rapamycin is not improving your metabolic health in whatever markers that we want to look, whether it's serum chemistry or visceral fat or power output on a cycle. We work with athletes. So it has to have a metabolic improvement. It means it has to be improving mitochondrial function. And if it's not improving mitochondrial function in some way, then we're not achieving what we want. Yeah,
Yeah, I mean, and one thing I liked about rapamycin with Alan Green reporting it himself, but like with Matt Caperline with the Dog Aging Project, they were seeing ejection fraction changes in the heart as a really like wow, significant thing. Are you looking at anything like that?
Not currently. I'm trying to work with a lab. There's a
Mhm.
lab in Germany that has the technology to actually look at the electron transport chain. So we actually be able to look at cytochrome 1, 4, and 5 through a blood spot, and actually activation of the peroxidase enzyme in cytochrome 4, which is the copper iron driven, which then goes to 5, which is magnesium, ATP. So that'll give us a better sense. It's still a lab, right? And labs are useful, but they have variance. But it gives us a sense of, and it hopefully can give us some good ideas that people can understand where they are. But labs are take a while to process, so that and they lag. So they're better for checking in periodically. So how can we, and I'm very much like as a background as an engineer, looking at how can we look at things phenotypically, right? How do we look at our body? And now we have the ability of using some devices, perhaps, that can guide us. And do you remember Broda Barnes? Do you ever study Broda Barnes? You
No,
get unsuspected illness,
oh,
hypothyroidism,
I know the
unsuspected.
name. Yeah, yeah, yeah. Uh-huh.
Yeah, so he was the sort of family doctor in the 60s, 50s, 60s that would have people check their body temperature with
Mhm.
a thermometer, right? And he determined that was one of his ways, along with old time doctoring, looking at people and their skin, their facial structure, and their eyebrows, and the hair on their legs, and the thickness, and the viscosity, and some other markers. He didn't need blood tests, right? He could very easily say that someone is, I think we would say, in his world, hypothyroidism, right? And he would give people natural thyroid and they would do much better and their temperatures would improve. It may not have been direct thyroid. It may not be a glandular thyroid problem at the time. It may have been sort of processing, which we now understand is even more nuanced. But it was very clear, when you paid attention to certain markers. So if mTOR, and this is theory based on reading, based on we're still working to it, we're going to work this out. If our goal is to achieve this fluctuating state, what does the body do when it's in a fasting mode, right? What what are there things we can look at that would say that we're in a state where the body's in a more autophagy mode, right? Circadian temperature is one. Um, you can look at metabolic gases, carbon dioxide, oxygen. You can look at deep sleep staging. Those are the three that.
Interesting.
So there's those three.
Because ketosis itself wouldn't be an indicator that you're in autophagy, because you could be in ketosis potentially with mTOR turned on. That's why fasting is an added benefit to a ketogenic diet. It's not enough just to be on a ketogenic diet. You need to do periodic fasting also, right?
Yeah. So one of the things, looking at working on. So I did. There's a company, and one could check their temperatures. And if you go to forums and you talk to people who are more motivated, they'll check their temperatures and they can see the temperature go down. But it's actually more than go down. Like a healthy circadian temperature is higher in the morning and lower at night. So there should be, again, in the body, some fluctuation. So I'd really like to start looking at that. And there's came across a device out of Switzerland that they were using for triathletes, and it measures sort of heat transfer. It's a patch, but it measures core temperature. So you can actually wear that and track your temperature throughout the week. And they use that for sleep staging as well. And then
Wow.
I'm trying, right, right. And then if you
Yeah.
can marry it with a good sleep staging device, which most of the wearables now are not, right? Like, or it's just not good for deep sleep. So I would really like to be able to pick up deep sleep. Now that's going to vary more, right? Like deep sleep and HRV. But if we see trends, so if someone's on a long-term plan and you're trending in the right direction, then you're doing something right, right? If you're trending in the wrong direction and you click 30-day moving averages, you're not. And we need to pay attention to that. The problem for a lot of people is they do 10 things at once
Right.
and you don't know what's working. You don't know if A and B are canceling each other out. So
Hey, what's the name of that
I
company for our hackers out there in the audience? You remember the name of that? Do they sell to consumers also for
yeah.
this,
So
the
for
thermal pet?
core temp,
Okay,
core
cool.
temp, and the medical. It's out of Switzerland. It's called Green Tag, GREENTEG.
Oh, cool.
Yeah, I actually have one right here.
Oh, nice. Very,
Yeah,
very
so
interesting.
that's used for cyclists and triathletes. They actually try and train them to get heat adapted. So
Mm.
they use their circadian temperature with certain training modalities. But I think I know because if you look at circadian temperature and some of the research, there is a link to that for sure. And interesting, and it came out recently, like current population based body temperature is lower. Like if you go back from 100 to 120 years, the nations has now a lower body temperature than they did, and
Huh.
that shouldn't be. So they said, "Oh, we got it wrong." Did we get it wrong? Excuse me. Did we get it wrong, or has our metabolic health changed? Right, and
Wow. Wow. Huh, that's
it's a catch,
fascinating.
and it's one of these things that's U-shaped. So you could be, if you're like I said, if you're hypothyroid, right? And we'll just say hypothyroid, your mitochondria are not producing enough energy and temperature, you're going to have a lower body temperature. Um, if you get a healthy metabolic system, your temperature is going to go up. But if you look at research, lower body temperature, seems to be a good thing. but only if you're intentionally cycling through that, right? So it wouldn't be a good thing to have a low body temperature in a metabolically unhealthy state where it's okay to have a lower temperature spread periodically if you're intentionally doing it, because then you're in a hormetic state and that the body likes,
Mhm.
right?
Well, what one question I want to shift to get to before we run out of time is the mTOR. It's this powerful signaling molecule, and there are benefits to being both on and off, and we want to cycle through it. In the modern diet, modern lifestyle is turning mTOR on all the way, which is bad and driving chronic diseases and metabolic disease as well. So, and we can turn mTOR down, as we've talked about with rapamycin. What do you think the role lifestyle plays in turning down mTOR by, obviously manipulating nutrition? So it'd be low carb and maybe certain protein, certain amino acids, maybe, but a low carb ketogenic diet could turn mTOR down depending on how you do it, or other things. So what is the role of lifestyle and rapamycin? Is it both, one or the other? What are the advantages? How do you look at that?
Clearly lifestyle is important, and sort of low carb, low calorie, lower calorie, because you can push protein and fat too high as well and still be keto and be driving mTOR. So you can do that, and I think it's a bit unclear, but my take is mTOR driven through strength training is not the same. Again, if you put on metabolic health lenses, right, not mTOR longevity research on rodents, like what do we want? We want to be metabolically healthy. And if you then sort of back off of that, things that you do that are going to make you metabolically healthy should not then be overdriving mTOR. I'm just not going to, I just don't believe that's the case, because phenotypically those responses, someone's insulin sensitive, they're lean, they don't have visceral fat, they have energy, they're not overdriving mTOR. Now, if you take a bodybuilder or someone who's trying to put on 40, yeah, they're going to be overdriving mTOR to achieve a particular an effect. So you need to be careful. And there's nuances within the diet, but whatever it takes to achieve that metabolic health, and however we look at it, whether it's circadian temperature or visceral fat, I'm, really quite impressed with how much of an issue that is, from inflammatory. And also the other big piece, which I didn't mention, is iron copper dysregulation. So rapamycin actually can play a role in preventing iron from depositing in the liver and actually improving copper into the mitochondria. They used it with tubular sclerosis, and there's paper that talks about one of its effects is driving copper into the mitochondria, which would then play a role with its mitochondrial effect. Iron, which the majority of our population is overloaded, is anabolic. Iron is an mTOR trigger. So if we exist in an iron overloaded state, we're chronically driving mTOR. Um, Deferoxamine, an iron chelator, is an AMPK activator, which I find like totally fascinating. That was just another drug randomly found that was supposed to be used as an antibiotic. They were trying to find SIBA in the 50s, something that would stop bacteria from growing, and they knew pull iron out, bacteria parasites don't grow. Right, the body needs. So they were looking at, and they couldn't get deferoxamine to work well as an antibiotic, but it was the first iron chelator. We don't lose, men and women in menopause don't lose iron any longer, right, ever. You know, I should. We used to. You know how we got iron out of our body? It's crazy when I saw this. Um, like, right, we don't, unless you were bleeding from injury. Helmets, hookworms.
Ah.
We had this synergistic. effect, obviously too much was not good, but if we were already always infected, sort of the pandemic for thousands of years is we had hookworms and helmets and they drained iron. And I haven't seen a paper, and I would bet, based that our the hemoglobin levels that we think for men now were much lower. Just like uric acid, right? Let's say the normal uric acid was like 3,
Yeah.
100 or 3.5, 100 years ago, right?
Interesting.
Now
That's
you're happy.
fascinating.
Yeah, it's
Huh.
like, whoa, that was a blow my mind when I came across that. So keeping iron um, down is really important within the mTOR world, and that's not a piece that is regularly discussed. So when I work with people, is donate blood. It's a good thing, and there's some nuances to it, but just donate blood every
uh,
2 to 3 months. It's a going to be beneficial to your health in a number of different ways.
we're almost out of time here. I have one question.
Sure.
I was recently reviewing literature on rapamycin, and I looked at the phenotypes of aging, and obviously was cherry picking the literature, but you could find studies where rapamycin given to mice, it makes the hair grow, it changes gray hair into black. You give it to humans on the skin, it restores the collagen and reverses wrinkles and aging. With periodontal disease, it slows, reverses that. With hearing loss, it corrects age-relating hearing loss in the animal model. With menopause, it actually increases fertility and delays menopause in animals. And then you look at the diseases. It's there's FDA indications for atherosclerosis where rapamycin coated stents actually stop that. Cancer and Alzheimer's disease. There's animals. What's going on here? All these different processes. What is it about rapamycin that affects every single phenotype of aging and all the chronic diseases? What's the underlying principle there?
Um, I just hang my hat on the main two. If there's some other nuances, right? I hang my hat on if it's adjusting mTOR, that's the biggest one, right? That's the elephant in the room. And the other thing, if it's affecting iron regulation, that's my other big elephant in the room. If there's some other subtle pathways, and perhaps it's autophagy as well. So it's having a role in the cells are able to clear out. I would say that's probably my guess. I don't know. What do you think?
Yeah, no, that makes perfect sense. Well, I think this has been a wonderful conversation. I think we need to do another one of these. I want to get you back on the program and on the podcast, and we could talk some more because there's so many things we
There's
haven't
nuance.
gone into. But maybe you could tell people in our audience how they could follow you on social media or your website and find out more information about you.
Yeah, I get right now. Personally, it's just Rick at ignitelongevity.com. I'm working on we can talk more about another time with a group of other physicians to do more N=1 true age reversal. Within the paradigm of instead of testing a molecule to see if that molecule is effective on 1,000 people, is working with individual people and use the tools that we have in our basket to sequence and synergize because age or sort of call it resilience is a symphony of different pieces, and the medical field is really dominated by individual instruments and not an orchestra because you can't study it, and it's really quite hard to combine multiple factors together because it takes a little work. So through that, I have a company that I started a number of years ago, Pure Clean Performance. Some really high quality beet juice based products for nitric oxide and essential amino acids. Our fund aminos is quite good. So if anyone wants to maintain a good protein status, using an essential amino acid which is 99% absorbed, um, you know, virtually no calories, it's a quite easy way to do it, and everything that we have there, we designed sort of for our family, for our local community of athletes, because that company was driven by performance athletes, and then sort of it's it's changed a little bit over the time for health and well-being. So that's it for now. But yeah, the consortium will be coming, and that's
Well,
where I'm
yeah,
spending most of my time.
I think we can devote a whole session to that. I want to get you
Yeah,
back,
it's a
back on the
complete paradigm
program
shift. Yeah, yeah.
and do
It's
that.
it's a
That's awesome. Well, thanks so much, Rick, for spending time with us today, and thanks for all the exciting work you're doing. It's been fun.
yeah, it's really fun. It's a big puzzle.
If you are enjoying this program, please hit that subscribe button, or even better, leave a review. Your support makes it possible for us to create the quality programming that we're continually striving for.
Can I start? Is it recording?
It's already recording.
Oh, sorry. This is for general information and educational purposes only, and it's not intended to constitute or substitute for medical advice or counseling. The practice of medicine or the provision of healthcare, diagnosis, or treatment, or the creation of a physician-patient or clinical relationship. The use of this information is at their own user's risk. If you find this to be on the value, please hit that like button to subscribe to support the work that we do on this channel. And we take your suggestions and advice very seriously, so please let us know what you'd like to see on this channel. Thanks for watching, and we hope to see you next time. You should say that.
No, that's good. That's for you to say. I think that's very good. You like it? You want to do it one more time, or is that good? I think that was good.
Yes.
All right.
You need to save the recording.